Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. Today on the episode, we're going to really find out what EHR should really be doing and how to unlock the data that they have been collecting all these years. To go on this journey with me is Dr. Michael Blackman, Chief Medical Officer at Greenway. Dr. Blackman, welcome back to the program.
Great, thanks Colin, great to be here.
Yeah, this is going to be a lot of fun. Usually you and I have some great conversations, looking forward to it. But let's start off by going right back to first principles. What should an EHR really be doing?
At some level, it's actually an easy question. The question is how well we actually do them. An EHR should help people provide better care, and it should be easy to use. It's really just that. And in some cases, we've made them more complicated than they need to be.
And so how are we going to get closer to that ideal goal? Because let's be honest, that sounds like amazing. And I'm sure lots of physicians like yourself would want that, but we're not there. So how do we get there?
We're not there for a few reasons. And I think it becomes a function of continually stepping back and looking at the workflows, trying to optimize them and saying, all right, what's there? Why is it there? What can we take out? What can we put in a way that makes sense for people? And sort of take out steps, make it as straightforward, as simple as possible, and frankly, as reliable as possible. It needs to be, the EHR at some level needs to be like plumbing. It needs to work every time you turn it on, it needs to work the same way you turn it on. And then from there, we're gonna start adding other pieces. Sort of historically, and part of the reason I think we're not there is that when EHRs initially came in, people viewed them a lot for billing.
Okay.
And so if you build something that's with a billing focus, it doesn't necessarily work that well on the clinical side. And conversely, if you build something that's strictly for clinical, it may not work so well on the billing side. So you have to balance the two. And certainly some of the regulation changes over the past couple of years have helped move us in that direction a little bit.
So are we, in your opinion, is the industry kind of coming into better balance now? They're moving away finally from being the billing systems into a little bit more.
I think we're getting there.
Okay, you're getting there.
A lot of the systems are just been around a long time, and sometimes moving them is not as fast as people would think.
Sure.
If we were building one from scratch today, might get there quicker, but then again, maybe not.
Okay. So, I think you and I can agree that we're well past the EHR implementation era.
Yes.
That has come and gone. We're now in the EHR optimization era, where people are really trying to leverage the investments that they've made in the EHR. How is Greenway working with its clinicians and its customers to optimize the EHR?
Yeah, so we've actually taken a step back.
Okay.
And whereas people like to look at well, what's new, what can I add, what new features. The step back we're taking at Greenway is to try to do some of the things I mentioned before. Let's go back and look at those basic workflows. How do we make it as simple as possible? And sometimes it's, in specific places, it could be simple things. What is the answer to a question 90% of the time? So let's default that answer, in the cases where we know that, and let you change it 10% of the time. If we leave it blank, well, you have to change it 100% of the time.
Right.
So 10's better. We're not going to get to perfect, but every place we can make those little decisions, take out as many steps as possible, it makes a difference. Because one of the things in the EHR, especially for Greenway in the ambulatory space, you have a clinician who's seeing, let's say, 20 patients a day. Some people see less, some people see more, some people see many more in certain specialties. But if you could take out 30 seconds a patient, a minute a patient. Well, if patients booked in 15, 20-minute slots, I take out a minute a patient, 20 patients. Well, that's another patient you could see. That's 20 minutes earlier home with your family. That's 20 minutes more that you spent with your other 20 patients. It's however one chooses to spend it. But it doesn't take a tremendous amount of time savings to have a tremendous impact.
Yeah, and what you're talking about is sort of these incremental improvements, right? Optimization doesn't mean you have to rip it out and completely replace or revamp totally. You're talking about just recognizing that 90% of the time it's this answer, and only 10% of the time do you change it. So instead of leaving it blank, like you said, just put that one in.
Yeah, the non-health IT example I tend to use with people is if you're going to buy an airline ticket, the airline website defaults to round trip, which is what most people buy. Then there's an easy way to switch to one way, which is probably what people buy next.
Right.
And if you want to buy a multi-city ticket, they take you to another screen. They don't try to do it in the same place because that's harder. Now, could you do the other things on the multi-city screen? Sure, but it'd be a pain.
Right. Yeah, and it would probably overwhelm a lot of people, right?
Exactly.
Who aren't used to booking multi-city stops.
So the more we can make the easy stuff easy, and if the hard stuff's an extra step, or the rare stuff I should say, so be it.
One of the ways that healthcare organizations want to optimize their EHRs is to leverage the data that's inside them a lot better, whether that's for research purposes or maybe even training an AI or building some sort of new machine learning algorithm. How is Greenway working to improve the quality of the data and access to that data that's inside your EHR?
Yeah, so Greenway actually has 2 EHRs.
Okay.
So we want to bring that data together to help people use it in that way. So we've actually built a data hub in conjunction with AWS. So we're putting that data, in the cloud to give us greater accessibility to it. We've normalized the data.
Gotcha.
So those are the building blocks that make using that data possible as we go from sort of, absolutely descriptive decision support to predictive decision support, using AI and other methods. The first thing is getting the data right, because if you don't feed it the right data, you're going to get the wrong information out.
Right, garbage in, garbage out,
Absolutely.
Right? But how about the access part of it? Like, how are you improving access to that data that's inside?
So as we do that, you end up with dashboards on the data as we move forward, query tools against the data, whatever business intelligence tools one would like, plus being able to feed that data back to help with decision support within the EHR itself. So it's 2 sides of the same coin at some level.
All right. Now, Dr. Blackman, every time I get together with you, I have to ask this question. Yep. What's next? What's coming down the road for Greenway customers? What exciting things can you tell us about?
Well, certainly if you look around, the show here at HIMSS, you hear a lot of people talking about AI and other pieces and chatbots and things like that. But ChatGPT. I think you're going to see slow incremental improvements in that way. I think the biggest thing for Greenway clients as we go forward is our real focus on usability, our real focus on making it easy, and helping people get better outcomes.
Where can people go to find out more information about Greenway?
So more information on Greenway is obviously available at our website, which is greenwayhealth.com.
Excellent. Dr. Blackman, always a pleasure to have you on the program. Let's get together again very soon.
Absolutely. Great to see you, Colin. Thank you.
Hey, if you enjoyed this interview as much as I did, we'd love for you to go to www.healthcareittoday.com for more great content like this. I'm Colin Hung for Healthcare IT Today. We'll see you on the next one.